Welcome to Indian Anatomist. Individuals who wants to pursue career in medicine are welcome to check out the YouTube channel Indian Anatomist. Now, one of the most essential aspects of learning about the brachial plexus is becoming familiar with the many disorders or injuries that can affect it. Please read. This animated diagram shows some of the potential triggers for a brachial plexus injury. I pray that my explanation makes sense. Brachial plexus injuries typically result from forcible traction or tugging owing to improper usage. This is possible at any age, from infancy to old age. In addition to this, brachial plexus injuries can be brought on by external trauma. Brachial plexus injuries can result from pressure, stress, overstretching, cancer and radiation, and sometimes due to birth trauma. Brachial plexus injuries disrupt communication between the spinal cord and the arm, wrist, and hand. This may imply that you are unable to utilize your hand or upper limb. Brachial plexus injuries frequently result in total loss of sensation in the affected area. The extent and location of nerve damage determine the severity of a brachial plexus injury. Some persons with limb paralysis make full recoveries, but others may be permanently disabled. Types of brachial plexus injuries. Commonly the following injuries may related to brachial plexus are 1. Brachial plexus neuropraxia, otherwise called traumatic injury of brachial plexus. 2. Brachial plexus rupture. 3. Brachial plexus neuroma, due to benign or non-cancerous tumor. Neuroma means disorganized growth or mass of nerve cells at injury. 4. Brachial neuritis, inflammation of brachial plexus or any peripheral nerves. And 5. Brachial plexus avulsion, pull, or tear of nerves. Now, what are the causes of brachial plexus injuries? 1. Birth injury or obstetric brachial plexus injury. 2. Blunt trauma. 3. Athletic injury. 4. Gunshot wounds. 5. Medical trauma. 6. Cancer. And 7 is radiation. Dear students, later in this video, I will discuss the birth injury of the brachial plexus. The most common birth injuries are Erb'S palsy and Klumpke's palsy or paralysis. The next section discusses the symptoms of brachial plexus injury. The most prevalent symptoms are 1. Upper limb numbness or loss of sensation. 2. Loss of upper limb movement, primarily of the shoulder, arm, wrist, and hand. 3. Upper limb spasticity. And 4 is burning, stinging, acute or abrupt pain in the shoulder or arm. To all of the students here, I will now explain how to diagnose these symptoms of brachial plexus injuries. 1. The commonest diagnosis methods are X-ray, or ultrasound of neck. 2 is by using the advanced radiology techniques like MRI and CT scan, with or without using contrasts. Finally 3 is nerve conduction study or electromyogram. This is an electrophysiological method to study the conduction of nerve impulses or muscle movements by giving microcurrents via electrodes. An abrupt violent movement of the head and neck away from the ipsilateral shoulder is commonly the cause of injuries to the upper trunks of brachial plexus, that is, C5, C6 and occasionally C7. Sometimes, the abduction of the upper limb above the level of the head is also known to induce injury to the lower trunk of brachial plexus, that is C8 and T1. Neurologically, the upper trunk of brachial plexus lies 2 to 3 centimeters above the clavicle, is called Erb's point. Erb's point is formed when the C5 and C6 nerve roots joins. The suprascapular nerve and nerve to subclavius emerge at this point. Distal to this point, the upper trunk, C5 and C6, breaks into anterior and posterior divisions. The upper trunk or Erb's point is common site for lesion, causes Erb'S palsy or paralysis. Often, Erb'S palsy involves C7 root, caused by head-shoulder interval expansion. This injury blocks movements of upper limb due to muscle paralysis and skin sensation. Most of the Erb's palsy is obstetric brachial plexus injury. In addition to birth injury, the injury can also be attributed to falls on the shoulder, external trauma, surgical interventions of the neck, or occurrences during anesthesia. The injury might avulse, strain or stretch, or rupture of the plexus roots from the spinal cord. According to the severity of the injury, paralysis can cure on its own, over months, or require rehabilitation or necessitate surgery. The main nerves that are affected in Erb's palsy are the suprascapular nerve, axillary nerve, and musculocutaneous nerve. What deformity caused by Erb's palsy? Erb's paralysis leads to a typical deformity of upper limb called policeman's tip hand, or porter's tip hand, or waiter's tip hand. In this deformity, the arm hangs by the side, adducted and medially rotated, forearm is in pronation and extension, and slight flexion of wrist and fingers. Clinical features of policeman's or porter's or waiter's tip hand is as follows. 1. An axillary nerve lesion paralyzes the deltoid muscle, causing shoulder adduction. 2. A suprascapular and axillary nerve lesion paralyzes the supraspinatus, infraspinatus, and teres minor muscles, causing medial arm rotation. 3. A lesion of the musculocutaneous nerve causes paralysis of the biceps brachii, resulting in extension and pronation of the elbow. 4. The lesion of C5, C6, C7 via radial nerve causes paralyses of the brachioradialis, supinator, and extensor carpi radialis longus, thus flexes the wrist and digits. And last is minimal loss of sensation along the lateral aspect of arm, due to involvement of roots of C5 and C6 spinal nerves. Now, I'm going to end this lecture on the subject of the brachial plexus. Hope you all enjoyed this session. Please watch further videos. Please like, comment, share, and subscribe. Good day all.